Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing as well. I'm going to have this as more like an open forum tonight, just so we could go over some big questions that we had basically over the last few days. And last week, I'm going to try to answer some of those ones that a lot of people were asking. So I'll wait for a few more people to come on and kind of go through and dive into some of the cases that we worked on and some of the different things that I do as a skin restoration specialist in Newport Beach, California. So mostly what I work on, and the reason why I work on it mostly I'll explain in just a few moments, but mostly what I work on are scars, and a lot of times I deal with acne scars, but I also deal with burns as well as with traumatic scars and surgical scars. I do a lot with scars because I found that you really have to just focus on something really to do it very well, and scars just deserved a lot of attention because just there wasn't much attention being given to it. Oh, hi, resident. How's it going? I saw that you're doing well still, so that's awesome. You're healing really well, and appreciate the update. Basically, really with you, I think you're going to end up ultimately having a really amazing result, especially as the collagen starts to continue to improve. You'll start seeing some of that over the next like 3 to 6 months. As I know you did it before, I know you know the process, but you'll start seeing that it's going to really start stimulating a lot more. Over the next few months. It's going to be awesome. We'll follow up with you in just a little bit too, but I'm glad that you're healing really well. At some point, we're going to do some more volume replacement. I think it's going to be awesome. Yeah, thank you so much. Appreciate you, Resin. And a good thing that we were able to touch base like that the last time. I think now you could fly in instead of driving. It'll be a little bit easier for you if you need to do another step there at some point. Pivotal Times is saying, hi, Dr. Qazi, can't wait to see you. Can't wait to see you too, Pivotal Times. Let me make sure that you tell me that was you that came on here. And, sometimes people say that they saw me on the live and they mentioned it, but they forgot their username or things like that. So make sure you tell me. Sierra is saying, how do you feel about Face Reality skincare for acne? There's a few different things. I think that there's a lot of different brands out there that have some components that are okay. And I think that's good. I think that's good that there's some brands that actually there's pieces of it. There's little bits of skincare things that potentially could work for acne. But my issue is that a lot of times it just doesn't really need this much. It doesn't really need this much with like cleansers and toners and everything else that kind of gets thrown in it. It's really a lot more basic than that. You a lot of times just have to do something that's going to control oil, and that could be like a topical retinoid. And then you want to do something that's going to help with the bacterial component of it. And a lot of times that means that it's like a sulfur-based wash or a sulfur-based cream. And then if it's, there's more bacteria there that you may want to do a topical antibiotic. And then sometimes you may need to escalate this for if it's more moderate to severe acne, you may need to do like oral Accutane, isotretinoin, or potentially something like the Accure laser. So all options there potentially, it just depends on what we're looking at. And essentially, there's a lot of people out there that will do these treatments and they overspend on their skincare products. And I don't think that's really good. That's really valuable for you. So I would not recommend that. What kind of treatments can I get if my budget is $5,000? $5,000 is a pretty healthy budget. We could definitely do a lot of things. Really, we could do a lot of different treatments within $5,000 if it's not requiring too much volume replacement. So that could really include like the vast majority of what we're doing for the combination treatment. It's just that the volume replacement, something let's say, for example, like Bellafill or Radiesse or Sculptra, that could require a little bit more. Have you ever had an adverse reaction to erbium laser in your office? Yes, definitely. I mean, it's usually it's something that's that it can occur if we're for a first few weeks or so. It could definitely be it's something where you may feel like there's more texture there, which is why we have a pre-treatment protocol and then a post-treatment protocol to really help you through that. It's extremely rare though, but it definitely could happen for the first several weeks really. And it's pretty clear, that could end up happening, that you could essentially end up having it where it feels like there's a little bit of texture there, but it's never something that's been long-term. It's like, okay, just follow along what I say. I could tell you though, that there are some people out there that, they vaped and, they did some other things afterwards. There's a lot of different issues that people do. They sometimes just don't even follow at all what I'm saying to do, and opt to do random creams and oils, literally oils that they discover on the internet, and they ultimately still get better, with the issue with like texture and things like that they may feel over the few months and a few weeks. But really, it's pretty frank and it's pretty obvious that that's what they're doing, and they're even it's really really obvious that they're doing that, and they say that they didn't want to use the pre-treatment. Sometimes they don't use the things afterwards, and it could take longer then. So it's the way I do it though, is I don't use much heat, don't use much energy really with it at all, and so it's more of like a lighter blend the way I use the erbium laser. And I have two ways of doing the erbium laser. I could do it like the fractionated form of it, or I do like the more ablative form of it. And even if I'm doing the more ablative form of it, when I'm doing the scar treatment, it's very, very low heat, low energy, so very low likelihood of any problems. Then just follow exactly what I say to do. It's actually remarkable, like how many patients we do Fitzpatrick 1 through 6 safely over and over again, and they follow exactly what I say. So that's how we could do it. We could do it over and over and over again, just like that. So that's what I would recommend doing. So if we could get this so that there's less downtime, less recovery, and really here's Resin is on here. There's a few other patients that are on here as well. Hi, Mrs. Jones. Good seeing you on too. Mrs. Jones saying I was in Jamaica. I'm doing really, really well. Thank you. And there's a few other patients on here that you'll see, and they follow along exactly what I say. And that's how we can be able to make sure that they get really, really wonderful results over and over and over again, no matter what the skin type is. It's really, really going to be about that. And then there's other things that, sometimes I've had a patient, I have not just one, but I had a few patients who they've gone in actually properly. It was like way too deep with the laser. And that's where it's more like scarred. It's not necessarily like just like the grid marks per se, just for like a short period of time. It's more like it's sometimes a little bit thicker quality skin, but it's not like a permanent damage too for that. Like it could be if we didn't intervene, but I did, solve that for those patients too. So they ended up really like, it was like they were distressed by the fact that somebody went a little bit too deep with their skin type, went too harsh, too much energy, and we're able to solve it still. So sometimes it still requires laser, but even just topical creams, things like that could actually improve that a lot too. So it's not like it's like this like lifelong, like there's like no hope the way people seem to act too. It's not true, actually. It's not the case. Like there's ways of doing things to get you to feel better, let your skin improve as well. How do you exfoliate with type 2 rosacea? I have it under control, but I'm scared to damage my skin. Don't exfoliate then. Don't do it. Really, type 2 rosacea, be very, very careful with that. That's where people, for those who don't know, it really could be like pustule. It looks almost like acne. There's a lot of bumps all over the face or on the nose and the cheek area. And there's a lot more rosacea when it comes to scarring than people expect. Actually, a lot of people are shocked by how much I really go through with rosacea with them. And they'll say, I suspected it was rosacea. I thought it was rosacea. I just didn't know. And I get that under control a lot of times. I try to really do something where we can control that just with like topical creams, antibiotics, things like that to make sure it gets under control. And then we could go tackle your scars better. It's so important actually to manage the rosacea part, because what ends up happening is that when that flares up, that gets really inflamed, and that gets really like just like red, and there's a little bit of oil production. That could mean that you get some breakouts over there. That could mean that you get delayed collagen response, delayed wound healing. So I definitely want to control your rosacea before we do treatments, and I do it over and over and over again. Today, I diagnosed several patients with rosacea or tried to manage that, because I wanted to make sure that when we do the scar treatments, we're not going to run into problems then with them. So it was okay, actually. They're going to be perfectly fine. And they understand, actually, a lot of people aren't surprised by it. They're just like, I wish somebody told me this beforehand. They were just always just saying that, here's a cream, but they never told me what the problem was. And I care about it a lot because I need it to be managed before we do your scar treatments. Lisa saying, if I drink alcohol, I get a rosacea outbreak, so I don't. Yeah, that's really common. And just in general, make sure, I tell people don't drink alcohol anymore, really. A lot of people don't like to hear that, but people in my generation, a lot of people in my generation were drinking a lot more alcohol. And I think the younger generation doesn't drink as much alcohol, but vapes a lot more. So it's like the 20-something group vapes, but the like generation in like the late 30s and 40s, 50s, they're drinking a lot more. And I tell people all the time that like that's something else that's going to cause inflammation, that could also cause more oil production. It actually could actually make so that you do get more oily skin. There's a lot of consequences with alcohol, and people don't really recognize really what abuse is because all their friends are drinking so much and things like that. They don't really understand where that line is, and it's very, very easy to go over that line very, very quickly. So one thing, I mean, that we could try to do is just try to get it so that people could drink less, because it's going to help out your skin. It's going to help out with your wound healing, your scars. You get a much, much better result actually for everything that we do. And then, of course, I also talk about vaping all the time, too. Huda is saying, hi, Huda. Huda's asking, hello, how much will the acne scar treatment cost? So most patients spend about $5,000 to $7,000, really. Most patients $5,000 to $7,000 for their scars. But if you have more volume loss, things like that, then we could definitely do other treatments then for that. Keep It Zen is saying, the subcision has made a visible difference. I was shocked to see how the swelling went down so substantially overnight. Thank you, Dr. Qazi. Look forward to the rest of our treatment plan. Awesome, Keep It Zen. Really happy to hear that. And that's, the rest of this is going to be awesome too. We are going to resurface this in, I believe, about a month or so. So it's going to be awesome there. But yeah, I'm glad that the swelling goes down faster than people think. It really does. It's actually interesting. People really do get worried. This week, actually, a lot of people that were so worried about subcision, so worried. They're like, they're watching the videos and they're saying that it looks really scary. It looks really daunting. So if you have questions about subcision, I'll be happy to answer for you guys, because I heard a lot of questions about that during, right before the treatment. A lot of people were just nervous about it. And I told them that, because we have this video going on in our waiting room, and it was maybe it was too graphic. I was like, maybe we should, I was walking past it, I was like, maybe this is too graphic for people and they're getting too nervous about it this way. So I was like, maybe we should make it a little bit more simple, just showcase exactly what the treatments are without people getting worried about this, because actually there's so much numbing when we do subcision. You'll see over and over people, actually Resin is on here too. You did subcision too. You could tell people too how it was with the subcision. I know there's a few other names I saw in here earlier with patients, and everybody, if you guys could say, it's just there's a lot of numbing that we could do. There could be anxiety though. There could definitely be anxiety. There's things that we could do for anxiety. There's things that we could do to make you feel comfortable. And actually, I'll teach you some breathing techniques that work out pretty well to help you refocus if you want that. But there's a lot of that actually. Like my patient the last day right now, it was interesting because she was so worried. She came all the way from Germany, actually, from Munich. And she said that she was just so extremely worried about the subcision part, because she did it twice before and apparently didn't do much numbing at all, and it was really painful, so it was really traumatizing for her. But then she was shocked that how relaxed it was. So Shay is saying, yeah, I need to be put for sleep for subcision. I think you really don't. Actually, you can do laughing gas if you want. That's okay. The nitrous oxides are fine, but it's actually going to be okay. You could do it. Actually, you'll see. There's really no pain with it. And I'll teach you some breathing techniques, and it's going to help you for the rest of your life with those. Let's see here. Let's saying, I've done subcision, had zero pain. That's awesome. Yeah. It's more like the pressure that you may feel. You may feel a little bit of tug. You may feel a little bit of that, but it's not actually so much that you feel it's actual painful. And what I tell people is that just that pressure that you're feeling, those are your scars that I'm breaking up. That's pretty cool, actually. And there's some people that realize that. They're like, hey, that was really actually cathartic. That was really great. And that's what I like. I want to hear that. Hi, doctor. Thoughts on Tazorac? So I like it. I think it's good. Tazarotene is good. Sometimes I think it could be a little bit too drying. That's why I really do like to start just a very low dose of tretinoin. I find that's just a little bit more tolerable for patients. So I just start really low dose tretinoin. When I was growing up, the big push was just to overly dry the skin when you had acne. Everybody was saying it was just the big push that you just got to dry your skin. It seemed I guess logical at the time, that if your skin is oily, that it means that you have to overly dry it. And it was actually the worst thing ever, really. I thought it was just a terrible option, really. It ended up constantly getting my skin really irritated. And it was just constant cycle. And instead of really just looking at this and maybe we should take a look at other creams or so, other options, it was just constantly escalating the tretinoin. And it ended up just it really making it so that my acne would get worse. It'll flare up because my skin was so dry. So interestingly enough, I think to this day, a lot of people still try to push this drying aspect, But I really think that the people pushing that never had acne. Really, I don't think that they did. Because if you have acne, you know that if you're overly drying your skin, it really can make it easier for you to get breakouts. You know, sometimes it just like ends up happening that you're not feeling like you're particularly oily, but you're still getting these breakouts because a lot of times it's just like your skin is so dry. And what's happening is that your body is basically trying to produce a little bit of hydration, and it's doing it with oil production. And then what ends up happening is that sometimes you get some bacteria that's trapped in the surface of your skin, and that causes a cystic lesion. So I myself suffer a ton of acne, and I was going through so many different things. So I knew that like physical exfoliants, you know, like St. Ives apricot scrub, a whole bunch of other random stuff that I used to do, all that stuff was just terrible for my skin. But I used to do it because everyone recommended it. I used to do so many different herbal supplements and creams and all sorts of stuff, all that stuff. I tried so many different things, and none of those things helped. I used lemon juice mixed with like aspirin, and that was like okay for a day, and then the next time I tried it, it would like ended up burning my skin and causing some pigmentation. So none of that stuff was a great idea, and I tried it all. And so if you need, like, if you're looking at this, like, hey, what have you tried? The only things I haven't tried are some of the newer stuff because I'm like worried that's going to break me out now. But yeah. Smiley saying St. Ives, I believe, caused my pitted acne scars. Yeah, it was terrible. I think it did too. Honestly, I think it did cause some of my boxcar scars. I actually do remember like scrubbing so hard like one day. I mean, I guess it wasn't necessarily the product at that moment, but like I was just trying to scrub because I thought that that's what you're supposed to do. People said you're supposed to exfoliate. It was like the big thing. There was a big push to exfoliate constantly. Everyone was saying to exfoliate. So I was trying to exfoliate a lot, and I actually sometimes would even use like a towel, like a wet towel on my face and try to scrub my face that way. And really, I'm almost positive it burst a lot of my postural pimples and ended up causing some scarring there, which probably could have avoided if I didn't do those things. So now we know. Now that's why I tell like you don't go through the same mistakes I did. Shane is saying I kind of cycle with hydrating and then giving my skin a break once in a while. My skin is weird. You should always hydrate though. Honestly, I don't think you're ever gonna hydrate enough. With like vanity cream is a really good option. Just continue to do that. It's gonna help out with that. Let's see here. Sona saying, or so saying, how do you plan the treatment for scars that when you have to do TCA and when the other treatments? How do you decide? So you could do TCA in almost any type of scar, actually. That's an atrophic scar, I should say. So let's say that we have ice pick scars. We could do it if you're very, very careful with it. We could do a boxcar scars. That's where it's really great, actually, with boxcar scars. And you could even do it with rolling scars. You could actually go inside the scar tissue and actually get a little bit of scar contraction. And you could do it even with rolling scars. So you could do it almost any of those scars. And a lot of times, it's rare for me to say I don't need to do TCA Cross, but there are some times where I just don't have to do it. It's just superficial enough that we could just go and laser that, and it's going to be okay. Keep It Zen is saying that the subcision was so satisfying. That's what she said the other day. It was very satisfying. I love the fact that you said that, actually. Thank you. Let's see here. So, and she's saying subcision didn't hurt. Thank you so much for telling everybody about that. The Huda is saying you have a very glowing face. Thank you. Thank you so much, the Huda. Iram is saying, Dr. Qazi, do you visit Pakistan? I don't. I hope everything is okay over there. Saw the news with everything over there. Hopefully, India and Pakistan just calm down a lot there, so that de-escalates, because the last thing we need in this world is just another catastrophe like that. But I don't know. It doesn't look good right there. Resident is saying, I really like the Vanity Cream. Never used it until you recommended it. Good. I'm glad. Actually, it's funny, right? Isn't it funny, Resin? You know what I was talking about when you came in about how many people are pushing these other products, these other moisturizers, everything like that. And here you have Vanity Cream, and it's like amazing, or like Cetaphil or CeraVe, and like these things are like really, really easy and really great. And so it's like, why not just like stick with those great moisturizers that cost $15, $20? When I was like starting a lot of these things, people were saying, you got to do your own skincare line, do your own skincare line. But I was like, I love this stuff. It's like so basic. Why would I like do something else? You're never going to be able to get it to the price point that it's at right now. I'd rather just focus on everything else that I'm doing and just do that at a really high level. And then it's like, these guys are pushing these moisturizers that are inferior to a product that's $15 to $20. Really. So it's awesome. I can just use it. It's a great product. Maddie's saying super oily, acne prone skin. What products do you recommend for moisturizer, pore minimizer, and toner? So super oily, acne prone skin. So we got to control the oil production. We could do a retinoid. So you could do just something over the counter, is different cream over the counter. You could do 10% azelaic acid once a week, 10% azelaic acid. You could do that over the counter also. And then I don't recommend really a pore minimizer or toner, just like a separate type of product. I think that's useless. Niacinamide is okay, that's fine, but like you just don't necessarily need to use it like right off the bat. But a retinoid and azelaic acid, great starting point there. And then moisturizer, we're just talking about Vanity cream. But the thing is, actually, one of my patients today, I don't know, sometimes she comes on, but she's saying that Vanity cream was burning her. But it actually turns out that there's different forms of it. So I always have to tell people now that you got to get the sensitive skin when it's blue and white and do that, because there's other versions of it that actually potentially could be irritating for my acne prone patients or patients who just did lasers and things. And so use the one that's the original, like it says sensitive skin. Use that one. That one works really well, and it's great after laser. All my patients that do lasers, they know we do that actually. We do Cetaphil, CeraVe, Vanity cream all the time because it's excellent for patients. Lucky Singh is saying, hi, Dr. Qazi, were you ever bullied for your acne? You talk about mental health and it sure takes a toll on it. Also, any recommendations for heat, sun sensitivity? Thank you. Good question, Lucky Singh. You know, it's a interesting thing. I don't know if I necessarily was bullied per se, like for acne. I definitely felt that, like I was talking about yesterday about like those microaggression type of things I was referring to, that I felt that people weren't necessarily really looking at me the way I would like to be looked at. You know, some sort of felt as if they just sort of dismissed me sometimes or so because potentially of my acne. And I definitely felt that way. You know, I do feel that like sometimes there was like excess comments about it, like, oh, why don't you wash your face differently? Why don't you do that? And there were certainly things like that. Whether it was necessarily like bullying per se for acne, tough for me to kind of gauge. And also, I remember at the time, you know, my family would always say that, like my parents would say that, you know, this is like a chapter in your life. It seems like it's super important when you're in when you're in high school, and then also especially junior high. But at some point, you're just going to forget about a lot of things, and a lot of things I kind of did forget about. You know, I don't really remember. But what I remember is actually how people were looking at other people. You know, I looked and saw how other people were being bullied. I saw that like there are people that were actually talking to them about you know, the fact that they had like pizza face and things like that. And you know, I was relatively like a taller person, and I kind of like you know was okay with other things in like, you know, sports and things like that. And so I kind of had a bit more like that I could be able to hold my own there. But there's a lot of people that didn't have that, and they were definitely picked on, and I definitely felt terrible for that. And I remember actually just like you know the way that people would be with a lot of people that were different with their acne, and the way that they would look at them, the way they would talk about them, and things like that. And you know, it wasn't. That's what I viewed it as. It just wasn't right. So it's not necessarily that I per se like happened to like feel like you know, that much direct bullying, but I felt like there was like, it was just unfair in this world that people were suffering from it. That's what I felt like. It was just unfair. And to me, it's like whenever there's things that are just like that, I just looked at it like it's just like things just had to change. Sailor Moon saying, did you ever get comments from your family about your acne, like backhanded ones? My own immediate family was amazing, actually, with it. Very, very supportive. Very, very supportive. But yeah, I mean, one time I went to like one of my uncles, kind of a distant uncle that we never really talked to again, but he used to like say, what's the latest treatment on acne that you should be doing? You should be doing a lot more with your acne. And like, he was like a physician too. And it was like, you know, it was like, I'm 16 years old, 17 years old. And like, that's like, it was like every day he was staying at our house, he was just like saying those kind of statements. And that was pretty annoying. You know, whether that was like bullying or not, I'm not sure, but it definitely makes you feel not great. Like, it's like, okay, that's not really a wonderful feeling that somebody's commenting and noticing your skin and mentioning it like that. It's one thing if they're like giving you like suggestions and like options to like make it see that you could do better. Like, you know, here's something potentially like that we should consider doing if you're suffering from acne to prevent scars. Like maybe we should work on it so that you could do something that you know, if it's like, you know, solicited advice, I should say. But the way people were acting with this unsolicited advice would also really problematic too for people. You know, so I didn't really appreciate those. Sailor Moon saying, my aunts would comment on my acne too, like why I'm not doing anything about it. Yeah, that was a very common thing, really, that people would just comment on people's skin all the time. And it's like, sometimes people will say if your weight, like it's just like, okay, your weight is a little bit heavier. If you lose weight, And it's like, there's never like this happy moment really for people. It's like, no matter if you're like bigger, like someone will comment on the fact that someone's bigger. If it's like you're skinny or someone will comment like skinny, it's like, yeah, like there's always something there. And then it causes people to get like body dysmorphia then, you know, it's like, it causes people to really obsess and get really scared and sad about things. And that's also partly why people end up getting scars or potentially gets, causes more trauma to their skin, because they start picking at it, because they just like, feel like this is something that like other people are going to comment on, or they're going to be like really frustrated about and worried about. And so they were worried about this, that there's like this big pustule pimple there, and they're going to have to someone's going to mention it and comment on it. And I could tell you that that's something I definitely felt a lot. Really, I felt a lot of pressure a lot of times, that like, if there was like a bump on my face or something like that, that someone would look at that, and it felt like that to me. You know, I didn't like that. I wanted people just to look at me and just like view me as like a regular person and listen to what I had to say as a regular person, and not focus on like little flaws like that or temporary issues like acne. And I think a lot of people probably feel that same way, you know. So it's microaggressions. I think that's really the proper real term. I think that my patient was saying that like a few weeks ago. He said he just experienced a lot of microaggressions. I think that's so true. And really, it's like, why, I wasn't bullied about acne at one point, but I had not even junior high, I was like actually elementary school bully. And then I guess in junior high too. This guy, his name is, we all thought that this guy was going to go into jail. Really, we all thought he was going to go to jail, or just like something was just like he was going to fall apart in the world. And he ended up just like loving the fact that he was a bully. He started calling himself, he's an MMA fighter, and started that's his name. He was like an MMA fighter and was calling himself the bully. That's what he was calling himself, the bully. And like, he's just like picking on everybody, just walking around town, like walking around the school. And we were like a really good, decent school. And this guy was just walking around like fighting people all day long. That's what he's doing, is just fighting people all the time. And it's like, he calls himself the bully right now today. And that's what I was saying yesterday, that like, it's nice actually that people with scars, people who have any type of, any feeling like this, where you feel like, okay, you had acne, you had scars, pigmentation, something that's like, that puts you a little bit to the side of other people. You start to observe a lot of this stuff, observe these bullies, and you could recognize these bullies now. You could recognize in society that there's these people out there that really do punch below their weight class. There's people out there that just like go at people like that. And it's like, okay, you could recognize that. That's a really good thing to recognize, because I can tell you, there's a lot of people out there that don't recognize the bullies in front of them. They don't recognize the bullies in the workplace. They don't recognize the bullies over in like in the corporate world, in the political space. They don't recognize bully countries, or one country becomes a bully. They don't recognize it, and it's still like they just have these starry eyes, and they just refuse to accept it. But if you look at it, because you had acne, because you had scars, and you start to see like these kind of microaggressions, and see how people are picking at people who are lower than them in status or weaker than them, you start to see that that's what the bully is. That's where you can really make this line in society. And it's going to be really interesting to see this segregation of going forward. And I think a lot of people are seeing that. A lot of people are feeling that same way that I did. Topaz is saying, that said, I also saw something similar. A young teenager came in to get a job and asked for a job application. And when he left, the manager laughed, saying they would not hire him. That's absolutely terrible. We had a patient just yesterday saying that, or a person on here yesterday saying that they were not hired as a crew member. I don't know if you guys remember the guy yesterday. He came on here saying that he wasn't hired as a crew member because of his scars, and he couldn't work there as a crew member. Imagine how that's going to feel for the rest of, for a while right there. Now, hopefully not the rest of his life. I think he will forget about it, because you'll move on. We'll work on your acne and your scars. But man, that's terrible. That's a terrible feeling. How long is the average downtime after a combination acne scar treatment? Usually about 4 to 7 days. Usually. Islam Ali is saying, hi, doctor. Good to see you again. Good seeing you too. Ali, I hope you're doing well. Let's see. HD is saying, is V-Beam good for active acne? And not so much. No, it's more really for the red marks, the PIE. That's what it's really good. It's really, really good for PIE. Mitra, I see you here. I just was answering some other questions. Mitra was asking why I didn't answer her question here. So where was your question here? Let's see here. Mitra, Doctor, I see that you use combination therapy, but why don't you use the punch method to treat the boxcar scar? I did it just today, actually. It just depends on what's happening. If it's like thicker scars, if they're deep scars, it has to be the right kind of scar. A lot of times these boxcar scars, if you punch it out, it's not going to heal as nicely as you want. It's actually going to have a little bit too much tension. So that's why I don't actually end up doing it that way. So sorry I missed your question earlier. I saw that you asked it a few times there. But hopefully you're still on and you understand that. But I'll go through it if you're still on. I'll explain it for you. But it's essentially along these Langer's lines that I use. I see really if it's perpendicular to those lines, then it likely could actually cause a little bit too much tension if you excise it. So I don't always excise it. Today I excised, just the last case that I did, I excised 3 of her boxcar scars actually. They're perfect. They're right along the line there. It was exactly perfect right there. She's the one that flew all the way from Germany, and it's going to be awesome. But it's not really for everybody. You know, there's some cases that we don't want to do that. It can make it worse. And some cases where it's just not needed at all. So we shouldn't really push it there. Its thumb is saying, do you recommend ablative Erbium YAG laser for deep acne scars after having acne for years? Unlikely, no. I usually don't recommend a fully ablative Erbium laser like that, especially the way people push it. I actually just do it. When I do it, I don't have much heat or energy when I'm doing it. But I see a lot of people that are using too much heat, too much energy for it, and I don't think that it's going to be particularly effective because just such broad heat on healthy tissue isn't great. But instead, I use a CO2 laser, or you could use an Erbium, like this pinpoint spot one. That's okay. You could do that for like the thicker edges of the scar. That works out really well. I don't think that I would do it otherwise, though. I wouldn't really do it like as a fully field ablative Erbium laser on vast majority of patients, unless it's like a lot of scar tissue. There's like something that we really need to do to justify that. It just in general would not be something I would do. What type of scars do people see best results after treatment? Actually, some patients will know I say it, and then I said it before during the consultation, and they'll see me 6 months or a year later, and they'll like know that this is the case. It's really a lot of times these boxcar scars with volume loss. Boxcar scars and rolling scars with volume loss. Because if we solve a lot of that volume, we actually break up that scar tissue with subcision, and solve a lot of that volume. It really does look really, really smooth. Smooth it down some more with the laser or so, but it just looks so good. It's really like 6 to 8 months or so afterwards. As long as you're doing that volume replacement, it could look awesome. So a lot of times it's like those deep boxcar scars and rolling scars. You could get a really, really nice improvement actually with that. Thoughts on azelaic acid? So it's a good exfoliant. You know, you could do it over the counter, which is nice. Just 10% azelaic acid. It works really well. Sometimes the thing is that people over exfoliate with their skin, so I don't recommend it for like every night for a lot of patients. But do it like, once a week or so and start there. And that actually is a good option there. Pivotal Times saying, I'm glad you mentioned different gel for oily skin. I have the gel and was only using it on a breakout. No, it doesn't work as a breakout cream. You should really be doing it for the full face. That's actually what it's supposed to be for. It's supposed to be suppressing oil production. So I used to do the same thing, actually. I used to put like retinoid on like each individual acne and think that that was going to solve the problem, but it's actually not a great option. It's not the way to do it. You really should be doing it for the full face. And then for small spots like that, you could do like antibiotic lotion if you need to. And then also something like silicone tape could actually be a really good option to help prevent that inflammation there. So something along those lines. Thoughts on monopolar Agnes RF? There's a big push for it a few years ago. They were saying that maybe potentially to use it for acne and for scars. I never really found that it was really going to help out too much for that. There was a thought that it could destroy some of the oil glands. Not really precise enough for that in my mind. And then the bigger problem is that I do worry with any of these radio frequency microneedling devices, any device that has heat or energy, and it's going that deep, I am worried about fat destruction with that. So I'm not a big fan of something like that. Unless it's for like skin tightening, it's a different process. But I don't recommend it really for acne or for scars. Y'all is asking how much water I drink each day. I don't know. I try to drink. I have like a big jug and I try to finish it usually during the day. So usually between patients, I'm drinking a lot of that there. So usually, I don't know. Sometimes I'm so busy that I don't get a chance, but usually I try. Let's see. Where was I at there? Can you use silicone sheets on hypertrophic scars on the nose? Yeah, it's awesome for that. It's awesome for that. Do that for sure. Do it every single night. Do silicone tape. Do that. You actually may see that, like if you have like a deviated septum or something like that, you may see that you breathe better with it too. So maybe consider that. Why is azelaic acid recommended for rosacea if it's an exfoliant? I'm so confused. Well, it'll help with a bit of there's a lot of times these little critters, these little microbes that are living on the surface, so it'll kill some of those. And then it does help a bit with the redness as well. So that's kind of the reason why. But there's a lot of other reasons that you may want to do azelaic acid that's not necessarily for rosacea, for like PIE. But there's other options for rosacea. I don't really use azelaic acid as a first line. Actually, I love ivermectin. I love metronidazole a lot of times. It's like excellent. So I use more like direct like antimicrobials for patients typically. Or like a triple combination cream, so there's less chance of antibiotic resistance, and you could combine that with like a few different options. And among those could be something like potentially azelaic acid, but maybe just that. Let's see your thoughts on VI body peel for acne scars from puberty. I'm 24. So actually VI body peel is okay for pigmentation, but not going to help much for the scars themselves. You usually want to go in there and actually break up some of the scar tissue with subcision in the body. Actually I did that actually on the patient's glutes today and broke it up. It looks almost like cellulite, but it was actually from acne scarring. It caused a big indentation there. And then we placed a little bit of Bellafill. So Bellafill actually can work very, very well on the body select spots. So that's what I'd usually recommend there. Yalda's asking, can you ever do lives where you let people join and talk about their skin? I mean, possibly. I would love. We have awesome conversations a lot of times when with my patients. Like, there's a lot of times that we're talking, and especially we're in a zone where we've done a lot of the bigger portion of things, and we could just talk. And it's really interesting, the things that we talk about, actually. Really interesting. It's like, I feel like one day it'll be a really cool series actually to have of just the things that like people are doing in their dreams and what they're trying to do, and like how they felt with their acne, and like how things were holding them back with their scars, or just like overall, just generally what they're trying to do with their career. I actually do like, I'm almost done for the tonight. I was just about to be finished. But I do actually like, especially people that are interested in like career stuff, because I tried almost every career out there. I tried a lot of different careers and a lot of different things. And, I'm somebody, I'll go through one day with you guys, but it took me a long time to figure out like how to focus like at a very, very, very high level. It was a really, really like a long journey. And I want everybody to learn that like a lot younger. I think it's going to help out like a lot of people. And the way I did it was like, I learned it, and it was just like so helpful. And there was, I think there's a lot of people out there that have a lot of potential, and there's a lot of people that are very, very intelligent, and they just weren't taught the way they should have been taught. And they use like their hands, and they should have been really like learning with their hands. And instead they were told just to memorize books, like myself. I'll raise my hand. That's me. I was told just to memorize books. And it's interesting because like there's people that actually do feel like a calmness, like a steadiness, ability to focus when they're reading. Like they're reading a book and a full series of texts, and they could actually just memorize that, and it's like calming for them. And then they could go and do really well on the test, and it's really rewarding. But those same people, really the same people, will then go in front of a patient, and now the patient is telling a story. Let's say you have like somebody in their 70s, 80s, 90s, and you're like, well, when I was a boy, this is what happened, and then there was in 1933 this happened, in 1950 this happened, in 1960 this happened. I went to this doctor, and now it's really tough for them to focus on the actual part that's important for the actual diagnosis of a patient, and they get really lost in the whole thing, and they become really terrible clinicians. Actually, a lot of times it's like they're very, very good with books, but they have a very, very difficult time following the conversation, figuring out the logic of a conversation, things like that. And that's a whole other skill set that really isn't tested properly. So, like people learn differently. Everybody learns a different way. And one day I want to kind of go through that for people, because I think that like it turns out that we're like teaching kids the wrong things. Like we're focused so much on one particular way to learn, and it may not be the best way to actually live your life and actually interact with clients or patients or anything else you're trying to do in the world. And it actually, your book, the way that you're doing for books was great, but it's possible that it could have also held you back from that ability. So, I feel kind of bad that there's a lot of people out there that could have gone into medicine or could have been more successful with whatever they're trying to achieve, and they're looking at things like, that there was hopeless. Here over and over, there are patients that are saying to me that, they were thought about going to medicine, but they're just not good at science. They're not good at that. Honestly, it's like these things like these organic chemistry labs, stuff like that. Like, who's doing organic chemistry as a physician? Who's doing it? We do so much of it in undergrad, so much of it, of like titrating and like making sure that these chemicals are balanced, all this stuff. Like, I never have to do that. I can understand the concept of it, but like the fact that it was like pushed so much and so crazy like that, it's really tough actually. And there's so many people that will just give up because they just see that. And like these doctors are happy about that. They feel like, oh, they had to go through this process, and like everyone else should actually end up having to go through the same thing. And it's like, we're never going to progress this way. Just like they're just like, oh, we had to have so much with student loans, and everybody else needs to have student loans too. It's like, it's ludicrous. So I think that we really do want to go through this and kind of change this way that people are learning, and people could focus a lot better. And you could actually, a lot more people could do exactly the way I'm doing this. And I've trained some people and other things, and I'm realizing that a lot of people just can't focus like that. They have a really hard time with focusing when a patient's in front of them, and there's like, sometimes it feels like it's monotonous, it's tedious type of work, but it's also actually, for me, it's like sometimes like a moment of zen actually. Like, it really is. It's like, what they describe as like just like zen, and just like this like complete peace. And I'm just like in complete peace as I'm breaking up that scar tissue, and it's like, oh, that's what that is. That's a pretty cool process actually. So it's it's kind of different than what people expect. Actually, they think that you can't find joy in certain things, and that means that you're like you should still just keep on doing it because it gives you money or so. But like, really, you should figure out like the thing that does find zen with what you're doing. Like, just get that. Like, there's like a book called Zen and the Art of Motorcycle Maintenance. I really recommend everybody read it. Actually, it's amazing. Sophia is saying, how far apart can we do Accure sessions, and is there any treatment you would pair with it with cystic acne? Would it also work on the neck and chest area? Yes, there's a few different things that we could do with cystic acne with the Accure. We could do with broadband light, and we could kill some of the surface bacteria with the broadband light. And usually we don't want to do too many other treatments with the Cure, but just more like topical antibiotics, things like that, or maybe what I would end up doing. It does work on the neck, and then it does work on the chest. If we're working on the back as well, that's totally fine too. You could do all those areas. And Itsan is saying, is this live session available later to watch? Usually it is, yes. Unless there was a problem with anything, there's usually meaning like there's a technical issue that like the sound was a problem or so, but yes, it is available. All right, guys, I appreciate you. Daria, I'll answer your question tomorrow because I just saw it right now, but I'll be happy to help you with that. Daria is asking about the difference between ablative and fractionated erbium. Is fractionated safer? I will briefly, just really quickly, would say that both are forms of ablative laser. It's just that there's fully ablative and there's fractionated ablative erbium. And I'll go through the difference of that and how we could do this. So either option could be safe for you. Thank you so much, guys. I will